Community pharmacy. Community pharmacy. A community pharmacy is a community-based pharmacy. Community pharmacy is generally recognized by the public as the most accessible source of drugs and of information about drugs. It is defined broadly to include all of those establishments that are privately owned and whose function, in varying degrees, is to serve society's need for drug products and for pharmaceutical services. Main responsibilities of community pharmacy: appropriate procurement, appropriate storage, appropriate documentation, dispensing of medicine and counseling on prescription to the patients with care, accuracy, and legality. It is an important branch of the pharmacy profession and involves a qualified and pertinent pharmacist. Being closely in contact with general people, the community pharmacist should have the required education, skills and competence to deliver the professional service to the community. Qualifications required to be a community pharmacist. In compliance with the vision of the Community Pharmacy section of the International Pharmaceutical Federation, community pharmacists should 1. Be experts in pharmaceutical care, pharmacotherapy, and health promotion. 2. Be professional communicators with patients, other healthcare providers, and decision-makers. 3. Deliver good quality in products, services, and communication. 4. Document their actions and make descriptions and publications. Community health. Community health refers to the healthy status of the member of the community to solve the problems affecting their health and to the totality of a health care provided for the community. Community health broadly encompasses the entire gamut of community efforts for maintaining, protecting, improving the health of the people. Modern community health seeks to bring together all the available health services, e.g., medical care, mother and child care, family planning services, environmental sanitation, laboratory services, disease control program, health education. Definition of health. According to the WHO, 1948, health is a state of complete physical, mental and social well-being and not merely an absence of disease or infirmity, so that each citizen can live a socially and economically productive life. Dimensions of health. There are 4 major dimensions of health included in the WHO definitions of health. 1. Physical health. 3. Social health. 2. Mental health. 4. Spiritual health. Besides these, many more can be cited, e.g. 1. Emotional. 2. Vocational. 3. Philosophical. 4. Cultural. 5. Socio-economical. 6. Environmental. 7. Political. 8. Educational. 9. Nutritional. Community health needs assessment. Community health needs assessment, CHNA, is a dynamic process undertaken to identify the strengths. Community health needs assessment. Community health needs assessment, CHNA, is a dynamic process undertaken to identify the strength. Community health needs assessment, CHNA, is a dynamic process undertaken to identify the strengths and needs of the community, enable the community-wide establishment of health priorities and facilitate collaborative action planning directed at improving community health status and quality of life. Its importance: 1. Provides baseline information about the health status of community residents. 2. Ensures that decisions are based on solid information and evidence. 3. Helps set priorities. 4. Can be used to guide policy and program development. 5. Can provide information on which funding is allocated. 6. Can assist in mapping out links and is interdependent with other sectors. 7. Can provide information to identify opportunities for disease prevention, health promotion and health protection. Healthcare. Healthcare is an expression of concern for fellow human beings. It is defined as the multitude of services rendered to individuals, families or communities by the agents of a health services or professions for the purpose of promoting, maintaining, monitoring or restoring health. Medical care. The term medical care is not synonymous with health care. It refers chiefly to those personal services that are provided directly by physicians or rendered as the result of physicians' instructions. It ranges from domiciliary care to residence hospital care. Medical care is a subset of healthcare system. Health system. The health system is designed to deliver health services. In other words, it constitutes the management sector and involves organizational matters. e.g. 1. Planning, 2. Determining priorities, 3. Mobilizing and allocating resources, 4. Translating policy into services, 5. Evaluation and health education. Levels of health care. Health services are usually organized at 3 levels, each level supported by a higher level to which the patient is referred. 3 levels are: 1. Primary health care, 2. Secondary health care, intermediate level, 3. Tertiary health care, central level. Thank you.